So good day everyone. For today, I am going to demonstrate the assessment of the abdomen. So before the general assessment, assemble the equipment first. So we have here our stethoscope, our skin marker, our tape measure, then our examining light. Perform hand hygiene and observe other appropriate infection control procedures. Good morning, ma'am. I am Janelle, a nursing student from St. Mary's University. What is your name, ma'am?
I'm Jamaica.
Okay, ma'am. So for today, ma'am, I am going to perform an assessment of your abdomen. Is it okay, ma'am? Okay, ma'am. So before I begin the general assessment, I would like to get your consent because during the entire examination, it is important to expose your entire abdomen so that I can assess it appropriately. Is it okay with you, ma'am? Yes. Then, provide for client privacy. So, ma'am, before I start the general assessment, I would like to inquire you if you have any history of the following. So, ma'am, did you have any incidents of abdominal pain?
Yes, sometimes.
Okay. Where, ma'am? Saan po? Okay. Gano'n po kasakit, ma'am?
Parang magtulog sa puso.
Tusok-tusok. May iba pa ba siyang associated na symptoms, ma'am? Yung nawawalan ka ng appetite, nagsusuka ka, wala naman po. Nanghihina. Ilang beses ka po tumatay or nagbabawas sa isang araw?
Pero depende na po.
Maraming nakain. Any incidents po ng constipation or diarrhea? Karoon ka po ba?
Noon pa.
Pas. Mga ilang taon or araw or months na kaya?
Taon na rin.
Taon. Years. So, nagkaroon ka ba ng change ng appetite simula nun or recently din?
Same.
Meron ka po bang food intolerances gaya ng lactose intolerance? Wala naman po. So, can you recall po kung ano po yung na-ingest ng mga pagkain from the last 24 hours? Pwede niyo pong sabihin na
Abdomen, upo.
ano pa po ba? Soft drinks,
Soft drinks. Karne ng baboy. Saka gulay.
previous problems po and symptoms na related po sa abdomen niyo. Aside from yung abdominal pain, wala naman po. Wala ka pong na-operahan dyan sa may parte ng tiyan mo. Okay, ma'am, thank you po. Assist the client to a supine position with the arms placed comfortably at the sides. Ma'am, can you please lie down? Place your arms at your side. Place small pillows beneath the knees and head to reduce tension in the abdominal muscles. Expose only the client's abdomen from the chest line to the pubic area to avoid chilling and shivering, which can tense the abdominal muscles. Follow the sequence of the assessment simultaneously. Start with inspection, followed by auscultation, then percussion, and last is the palpation. Now, ma'am, I am going to start the general assessment. So I will begin with the inspection of the abdomen. So inspect the abdomen for skin integrity. Look for any stretch marks, hematoma, engorged veins, and scar. So ma'am, can I lift now your t-shirt? Then, inspect the abdomen for contour and symmetry. Observe abdominal contour while standing at the client's side when client is in supine. Then, ask the client to take a deep breath and hold it. Ma'am, can you take a deep breath and hold it for a second? Okay, thank you, ma'am. Then, assess the symmetry of contour while standing at the foot of the bed. If distension is present, measure the abdominal girth by placing a tape around the abdomen at the level of the umbilicus using centimeter. Then, observe abdominal movements associated with respiration, peristalsis, aortic pulsations, and observe the pattern of the vascular. Inhale, exhale lang po. Now I am going to perform auscultation of the abdomen. Auscultate the abdomen for bowel sounds, vascular sounds, and peritoneal friction route. Then, auscultate near the abdominal aorta. Then now I am going to perform percussion of the abdomen. So percuss several areas of each of the quadrants to determine presence of tympany and dullness. So use a systematic pattern. Begin in the lower left quadrant, then proceed to the lower right quadrant, then upper right quadrant, and then the upper left quadrant. So ma'am, I'm going to begin. Then, percuss the liver to determine its size. So after the inspection, auscultation, then percussion, last is the palpation. Now ma'am, I am going to perform the palpation of the abdomen. Remember, if the client complains that a particular area is in pain, it must be palpated last. So perform light palpation first to detect areas of tenderness or muscle guarding. So systematically explore all 4 quadrants. Then, perform deep palpation over all 4 quadrants. Then, palpate the liver to detect enlargement and tenderness. Palpate the spleen. Then, palpate the kidney using both hands. Palpate the supraumbilical segments. So ask the client to raise the head. Mom, can you raise your head for a moment? Thank you, Mom. Then, palpation of the bladder. Palpate the area above the pubic symphysis if the client's history indicates possible urinary retention. Okay, Ma'am, thank you for your cooperation. Then, document findings in the client's record.